We've spent a lifetime enjoying the sun's warmth. We've worked hard, raised families, and made memories. As we enter our golden years, it's time to prioritize our health, especially our skin. Our skin has been with us through thick and thin, protecting us from the elements. Over time, our skin naturally changes. We may notice wrinkles, age spots, or other marks of time. However, we need to be aware of changes that could signal a more serious issue, skin cancer. Today, we're going to have an open and honest conversation about skin cancer. We'll explore the different types of skin cancer, the warning signs, and the steps you can take to protect yourself. Early detection is key when it comes to skin cancer. The sooner it's caught, the better the chances of successful treatment. This video is all about taking charge of your health. Let's dive in and learn how to keep our skin healthy and vibrant for years to come. Before we delve into skin cancer, let's appreciate the remarkable organ that is our skin. Our skin is our body's first line of defense, shielding us from harmful UV rays, infections, and injuries. Think of your skin as a complex, multi-layered shield. It's constantly regenerating with new skin cells replacing old ones. However, sometimes things can go awry, and that's when skin cancer can develop. Skin cancer occurs when skin cells begin to grow and multiply uncontrollably. Understanding the basic structure of our skin can help us grasp how skin cancer develops and why early detection is so important. Imagine a well-organized garden where each plant has its designated space. That's how our skin cells normally behave. But with skin cancer, it's like some plants start growing out of control, invading the space of others and disrupting the garden's harmony. These abnormal cells multiply rapidly, forming a mass of tissue called a tumor. Malignant tumors can invade nearby tissues and even spread to distant organs through the bloodstream or lymphatic system. The good news is that most skin cancers are highly treatable, especially when detected early. Skin cancer isn't a one-size-fits-all disease. The three most common types are basal cell carcinoma, or BCC, squamous cell carcinoma, or SCC, and melanoma. Basal cell carcinoma is the most prevalent type. It often appears as a pearly or waxy bump. Squamous cell carcinoma is the second most common type. It typically presents as a firm red nodule. Melanoma, though less common, is the most dangerous type. It can appear as a new, unusual-looking mole. We all love a sunny day, but it's important to understand how sun exposure impacts our skin over time. The sun emits ultraviolet radiation, which can penetrate our skin. Over time, this bombardment can damage the DNA in our skin cells, leading to mutations that can cause them to grow out of control. The more sun exposure we accumulate throughout our lives, the higher our risk of developing skin cancer. We'll discuss sun protection strategies in detail later on. While anyone can develop skin cancer, certain factors can increase our risk. People with fair skin, light hair, and light-colored eyes are more susceptible to sun damage and skin cancer. Genetics also plays a role. If you have a family history of skin cancer, especially melanoma, You may be at increased risk. It's important to be aware of your family history and discuss it with your doctor. As we age, our skin naturally becomes thinner and more fragile. It produces less collagen and elastin, the proteins that keep our skin firm and elastic. Every sunburn, every tan, every day spent in the sun without protection adds up over time. This is why it's never too late to start protecting your skin. Other factors that can increase skin cancer risk include a history of severe sunburns, a weakened immune system, and exposure to certain chemicals. By understanding these risk factors, we can make informed choices to protect our skin and reduce our chances of developing skin cancer. Our skin speaks to us, and it's up to us to listen. Be aware of changes in our skin, new moles, or changes in size, shape, or color of existing moles. Early detection is crucial. Examine your skin regularly. Look for anything new or unusual. Consult a doctor if concerned. When it comes to melanoma, the most dangerous type of skin cancer, early detection can be life-saving. That's why it's essential to be familiar with the ABCDEs of melanoma. A is for asymmetry. One half of the mole doesn't match the other half. B is for border. The edges of the mole are irregular, blurred, or notched. C is for color. The mole has different shades of color. D is for diameter. The mole is larger than 6 millimeters across. E is for evolving. The mole is changing in size, shape, color, or elevation, or it's new. While changes in moles are often the first thing that comes to mind with skin cancer, other skin changes can also signal a problem. Be on the lookout for sores that don't heal, unusual growths, or patches of skin with different textures or colors. Seek prompt medical attention to protect your skin health. When it comes to skin health, dermatologists are our allies. They are doctors who specialize in diagnosing and treating conditions of the skin, hair, and nails. Don't hesitate to reach out to a dermatologist if you have any concerns about your skin. They are there to answer your questions, address your worries, and provide expert guidance. Remember, early detection is key when it comes to skin cancer. A skin checkup with a dermatologist is a straightforward and painless procedure. The dermatologist will begin by asking about your medical history, including any family history of skin cancer, your sun exposure habits, and any skin concerns you may have. Next, they will examine your skin from head to toe, using a bright light and a magnifying glass if needed. They will pay close attention to any moles, spots, or other growths on your skin, looking for any signs of abnormality. The dermatologist may also feel your lymph nodes, which are small bean-shaped glands that help fight infection. If the dermatologist finds anything suspicious during the skin checkup, they may recommend a biopsy. A biopsy is a minor surgical procedure in which a small sample of skin is removed for examination under a microscope. The biopsy site is usually numbed with a local anesthetic before the procedure. The biopsy sample is sent to a laboratory where a pathologist will examine it under a microscope. The pathologist will look for any abnormal cells that could indicate skin cancer. If you've received a skin cancer diagnosis, it's completely understandable to feel a mix of emotions. But remember, you're not alone on this journey. Your healthcare team is there to guide you every step of the way, providing support, information, and personalized care. Your team may include dermatologists, surgeons, oncologists, and other healthcare professionals. Your healthcare team is committed to working with you to develop the best treatment plan based on your individual needs and preferences. Surgery is often the primary treatment for skin cancer, especially in its early stages. The goal of surgery is to remove all cancerous cells while minimizing damage to surrounding healthy tissue. One common surgical procedure is called excisional surgery. In this procedure, the dermatologist or surgeon uses a scalpel to remove the entire tumor, along with a margin of healthy skin around it. Another surgical option is Mohs micrographic surgery. This specialized technique is often used for skin cancers in areas where preserving healthy tissue is crucial, such as the face, ears, nose, and lips. In addition to surgery, there are several non-surgical treatment options available for skin cancer. Cryosurgery, also known as cryotherapy, is a procedure that uses extreme cold to destroy cancerous cells. During cryosurgery, the dermatologist applies liquid nitrogen to the tumor, freezing and destroying the abnormal cells. Radiation therapy uses high-energy rays to kill cancer cells. External beam radiation therapy delivers radiation from a machine outside the body, targeting the tumor with precise beams. Topical chemotherapy involves applying anti-cancer medications directly to the skin. We've talked about the sun's role in skin cancer development. Now, let's focus on how to enjoy the sun safely. Sun protection is our first line of defense against harmful UV radiation. The most important weapon in our arsenal is sunscreen. Choose a broad spectrum sunscreen with an SPF of 30 or higher. Apply sunscreen generously to all exposed skin 20 minutes before going outside, even on cloudy days. Remember, UV rays can penetrate clouds. Reapply every 2 hours, especially after swimming or sweating. Think of your clothing as an extra layer of protection against the sun's rays. When choosing what to wear outdoors, opt for clothing that covers as much skin as possible. Long sleeve shirts, long pants or skirts, and wide-brimmed hats are your allies in sun safety. Darker colors tend to absorb more UV radiation than lighter colors, providing better protection. If you can see through it, UV rays can penetrate it. Sunglasses are also crucial for protecting your eyes and the delicate skin around them. Early detection, your skin's best defense. Empower yourself with the knowledge to detect skin cancer early. Your skin is talking to you, and it's up to you to listen. Perform regular self-exams of your skin. Use a mirror to check hard-to-see areas. Pay attention to new moles, spots, or changes. Remember the ABCDEs of melanoma. If you notice anything concerning, make an appointment. Early detection is key to skin cancer. Be proactive and informed to protect your health. Embracing skin health in our golden years. I hope you've gained valuable insights into skin health and skin cancer. Our skin deserves our attention and care, especially in our golden years. We've learned about skin cancer types and warning signs. Prevention, from sun protection to self-exams, is key. Your healthcare team provides guidance and support. Enjoy your golden years with confidence and vitality. Thank you for joining me today. And here's to healthy, radiant skin.